Thank you for joining us today and welcome. My name is RJ Mercedi, Manager of the Center for Nonprofit Excellence at Fairfield County's Community Foundation. Throughout 2018, we're pleased to host a series of community conversation webinars to spark discussions about topics and issues impacting Fairfield County. For over 25 years, Fairfield County's Community Foundation has been working to ensure that every individual in our region has the opportunity to thrive. To create lasting change in Fairfield County, we bring together bright minds, bold leaders, and trusted resources. As a philanthropic advisor, the Community Foundation manages close to 600 charitable funds. As a grant maker, we've provided over $200 million in support of the nonprofit sector. And as a community partner, we unite people and resources to address closing the opportunity gap across the 23 towns and cities in Fairfield County. We can't do this work without the support of all our partners, donors, nonprofits, elected officials, and other philanthropic organizations. And we invite you to join us for Fairfield County's Advocacy Day on May 31st, hosted at Grace Farms Foundation in New Canaan. I'm very pleased to be joined by Jim Horan, Chief Executive Officer of the Connecticut Association for Human Services. Jim, welcome.
Thanks, RJ. I appreciate the opportunity to present today. A little bit of background about my organization. The Connecticut Association for Human Services is a statewide nonprofit organization that works to reduce poverty and it works to reduce child and family poverty and build opportunity at the state capitol and in communities across the state. Family economic success is the umbrella for all of CASA's work, which includes advocacy for tax initiatives, early care and education, post-secondary education, and two-generation strategies, as well as programs including volunteer income tax assistance, the Connecticut Money School for Financial Education, and one-on-one financial coaching. CASA is also the Annie E. Casey Foundation's Kids Count grantee for Connecticut. We compile data and write policy reports on the well-being of children and families. And our most recent report is very relevant to this discussion. It's called Race Equity in the 5 Connecticut's, and it looks at disparities in education, health, economic security, and family and community indicators.
Thanks, Jim. I know we're going to get into a lot more of that in our conversation today. But before we get started, I want to take care of some housekeeping. So we do want this to be an interactive discussion. We invite you to submit questions in the question box that you should find on the right hand of your screen. Please contribute your questions at any time. If you don't see the question box, just click on the small orange arrow in the top right hand corner. We have a few conversations to start the conversation, so let's go on. So Jim, we've heard the phrase opportunity gap thrown around before. What does it actually mean?
Sure. The opportunity gap refers to disparities in income and wealth, education, employment, housing, and health, generally comparing whites and Asians to African Americans and Latinos, and people living in wealthy to people living in poor areas. We'll start by looking at a few of the indicators that demonstrate the opportunity gap, including income, employment, and housing. If you could go to the next slide. This first chart shows income inequality, showing the top and bottom household income quintiles for the United States, Connecticut, and Fairfield County. This chart is from the Fairfield County Wellbeing Index published by the Foundation. The bottom 20% is in amber, the middle 20% in red, and the top 20% is in green. Disparities between the top and bottom quintiles are substantial everywhere, but they're even bigger in Fairfield County than in the state and the country. Fairfield County has some of the biggest income disparities in the nation, and that's received a lot of attention, including a report just last week from Bloomberg that showed that Fairfield County income disparities were the third fastest growing among the nation's 100 largest metro areas. Next slide. Another important component of the opportunity gap is in employment. This chart from the U.S. Census Bureau's American Community Survey shows unemployment by race for the United States, Connecticut, and Fairfield County. Generally, unemployment among African Americans, which are represented by the red dots, are almost twice as high as the overall rate, shown by the green dots. And that was 15% versus 8% in Fairfield County, the year of this survey, 2016. Latino unemployment in purple is also significantly higher, although that varies more by jurisdiction. And as with many other indicators of opportunity that we look at, Asian and white unemployment are lowest and pretty similar to each other. Next slide. A third way that the opportunity gap plays out is in housing. This chart, which is also from the American Community Survey, looks at the percent of households that are cost burdened, meaning that they're paying more than 30% of their household income to rent or own their home. Not surprisingly, the lower your income, the more likely you are to be housing cost burdened. Also not surprisingly, the problem is worse in Fairfield County than in Connecticut, which is worse than in the U.S. as a whole. And I say not surprisingly because housing costs in Fairfield County are among the highest in the nation, and even though incomes are also high, they're not sufficient to compensate for the higher costs. So these three slides capture elements of what we're talking about when we say opportunity gap in income, employment, and housing. We're also going to talk about education and health as we go on.
Thanks, Jim. It's important that we know the realities that many face in our state and especially in Fairfield County. Can you speak a little bit about what strategies have been successful in helping to close the opportunity gap?
Sure. And I know it can be discouraging to see how large the opportunity gap is and how it plays out in so many spheres. But the good news is that there are areas where we're making progress, and these can provide some guidance about how we can make more progress in the future. If you wouldn't mind going to the next slide. So this chart looks at early care and education, where Connecticut is a national leader. While 48% of 3- and 4-year-olds nationally are enrolled in preschool, Connecticut is at 65%, that's the green bar on the left, and Fairfield County is even higher at 70.5%. Almost every Fairfield County town is above the U.S. average except for Danbury, which is shown in bright blue here. And that's important because there's a body of research that shows that preschool helps to close achievement and economic gaps for children who are poor, immigrants, and non-English speakers. Next slide. Another area where we've made a lot of progress in closing the opportunity gap is in health insurance. This chart shows the percent of children who are uninsured in Connecticut by race. While Latino children are still more likely to be uninsured by others, they're shown in red here, the rates of uninsurance dropped significantly for all races from 2012 to 2016, and the rates for African Americans are at about the same as other racial groups. Next slide. This chart shows uninsurance rates for adults in 2015. As with children, the rate of uninsurance is low, just 5% in Connecticut and 6% in Fairfield County, compared to 9% nationally. Unfortunately, Fairfield County's 3 largest cities, Bridgeport, Stamford, and Norwalk, all had rates that were equal to or slightly above the national average. Connecticut's made a lot of progress on health insurance for children and adults. Of course, we're going to need to work hard to maintain that progress in the face of changes to health insurance at the federal level. Next. One more area of great progress for Connecticut is on homelessness. As shown in this chart, from 2007 to 2017, there was a 24% decrease in the number of people experiencing homelessness, including a 13% decrease from 2016 to 2017, and this is a statewide figure. The number of individuals experiencing chronic homelessness, that's long-term homelessness and living with a severe disability, has decreased even more, 60% since 2014. And nearly 60% of those who were counted as chronically homeless, were in the process of securing permanent housing. So Connecticut has really effective programs in place to completely eliminate homelessness among veterans and families, and that's part of a coordinated access network among all providers. And I'll just say one more area of progress, in addition to homelessness and health insurance in preschool, is in reducing the prison population. And Connecticut's prison population has dropped 30% over the past 9 years, while crime rates have remained low. And so we're a national leader in that area as well.
Yeah, some pretty remarkable stats there. Thank you. I do see some questions coming in. I just want to remind you that you can ask them anytime in the question box, which we'll get to in just a few minutes. I do have one more question for you, Jim. So we know the realities, we know what's been working. How do we move forward from here?
Sure. So Connecticut has persistent opportunity gaps in a lot of areas, but there's also some areas, as we've shown, where there's been pretty substantial progress, in part due to federal and state policy investments, along with major investments and engagement by philanthropy, nonprofit, and others. It won't be easy to make a lot of progress in closing the opportunity gap. This is hard work, but there are certain areas where it's pretty clear we need to focus. Next slide. So K-12 education is perhaps the most obvious opportunity gap. Clearly, there are children who lack access to quality schools and the resources they need to succeed academically. This chart shows fourth grade math proficiency in 2015 from the Fairfield County Community Wellbeing Index. While a higher percentage of fourth graders in Connecticut and Fairfield County score proficient compared to the nation as a whole, as do students in Stamford and Danbury, only 7% of Bridgeport's fourth graders were math proficient in 2014. That's the amber bar in the middle. There are similar results for fourth grade reading and for eighth grade math and reading. So there's a lot of areas where we need to make progress, and it's the case in Bridgeport as well as other central cities around the state, including Hartford, New Haven, New Britain. One piece of good news recently is that high school graduation rates are rising statewide, and the biggest increases have been in the poorest districts, including Bridgeport, which may be due to some increased state resources for these districts in recent years, although it's still the case that resources are not yet truly equitable, and we don't yet have equitable opportunity for all kids. Next slide. In addition to K-12 education, to narrow the opportunity gap, we also need to focus on post-secondary education. While Connecticut, Fairfield County, Danbury, and Stamford outperform the U.S. as a whole for college enrollment rates, Bridgeport's rate is significantly lower. And it should also be noted that Bridgeport was starting from a lower base because in 2012, it had a 20% lower rate of high school graduation than the state as a whole. And then there's additional data that shows that poor students and students of color are less likely than others to graduate from college. This is an area that the Connecticut General Assembly is looking at right now, including allowing Dreamers to be eligible for state scholarship funds and separate legislation that would make community college free for students from lower income households, although that's likely to be caught up in the state budget problems this year. Next slide. So improvements to K-12 and higher education are critical to narrow the opportunity gap so that everybody has the education and the skills for jobs that can support themselves and their families. This chart shows income levels by race and ethnicity for the United States, Connecticut, Fairfield County, and Bridgeport. As with some of the other data that we've been discussing, Asians, which are represented in purple, whites, and in amber, fare best, while African Americans in red and Latinos in blue lag. And then looking on the right side of the chart, which is Bridgeport, residents of Bridgeport do worst of all, regardless of race. As with K-12 education, there's no single fix, no simple solution for this to reduce income disparities, but there is a clear correlation between the lower test scores in early grades and lower household income later in life. One area that my organization is working on a lot is two-generation strategies that help to bolster early care and education for young children at the same time that they help parents with education and skills training. And there are a number of local organizations that are embracing this concept in Fairfield County, including Norwalk Acts, Bridgeport Prospers, and Stamford Cradle to Career. And that's the kind of collective impact initiative where we think when you have state and local government working together with philanthropy, nonprofits, and others, and their efforts are aligned and they have a common goal, they can achieve pretty significant impacts. This is what's working in Connecticut for preschool, homelessness, and health insurance, and we think that it can work in other areas as well. And that's all that I have. But I'd be happy to answer questions.
Yeah, definitely. And they're still coming in. So thank you, Jim, for all of that and for the questions that we have so far. So I'll start throwing them out. One was really just to me, and this was just asking about if this is going to be recorded and if folks could have the slide deck. So yes, you can email me to get that information, and it will be up on our website, the video itself, by Thursday. Jim, so here's a question. What's been the impact of limiting the amount of development and education that community college students take to start their college experience?
Yeah, so that's an interesting question, and there's not yet great data on this, but this is an area that we've looked a lot at, and the questioner is asking about legislation that was passed, I believe, going back to maybe 2012, that limits the number of remedial or developmental education classes that students in community college can take, and kind of creating a triage system with students who really don't need any developmental education but might have been placed in it before, students who can succeed with 1 year of developmental ed, and then another group of students that aren't really even ready for developmental education classes because it'll take them more than a year to get from developmental ed to classes that can earn credit. So Connecticut has been a national leader in implementing this, and there are definitely some positive results from it, with fewer students being placed in developmental ed and more students being able to succeed getting out of developmental ed classes within 1 year. The jury is still out as for the third group, the lowest performing students who aren't even really ready for developmental education classes. And the legislation's been tinkered with a couple of times over the years since it was originally passed to have those students take classes with adult education, local adult education programs, or with special programs within community colleges. But we need some more data to really know how well that's working. But it's an important area so that everybody can succeed, because our belief is that you need some level of post-secondary education, not necessarily to get a BA or BS or even an associate's degree, but some credential beyond high school in order to earn enough money to support yourself in Connecticut. And it's even more true in Fairfield County, which is so expensive.
Mm-hmm. Another great question coming in. What are some of the reasons why there is a higher percentage of Hispanics uninsured?
Yeah, so that's the case nationally as well as in Connecticut, and I'm not certain of this, but I think a couple of factors are language barriers, which of course we've worked to try to address in Connecticut and elsewhere, but not always successfully. And then it may also be a question of legal status and whether people are deterred from applying for health insurance either because they're not qualified because they're undocumented, or because they fear that there might be some repercussions from enrolling. So I think that those are probably a couple of the factors.
Great. Another question. Do you have any research relating to the costs of childcare and how they might affect or be affected by some of the other statistics you shared?
Yeah, so good question. I mean, childcare is very expensive, and Connecticut, it's like for some other costs, it's higher in Connecticut than it is in other states. Nonetheless, I'll mention the childcare workforce is very poorly paid. So this is a big problem. A major area of focus for CAS over the years has been on the Care for Kids Child Care Subsidy Program, which is often underfunded, meaning that the state makes cuts to it, knowing that it's not going to be able to allow all children who qualify for Care for Kids to actually enroll in child care subsidies. And then there's a waiting list that develops. And that happened over the past year. And the number of children in Care for Kids dropped from, I believe, 22,000 to 13,000, a dramatic drop. Since then, some of the funding has been restored and enrollment is increasing, and it's up to, I believe, a little under 16,000 at this point. But we need to make sure that the program is adequately funded and remains open. The budget is being debated right now in the legislature. The last day of the legislative session is May 9th, and they need to pass a new budget by that time. And this is one area of contention. And Democrats in the Appropriations Committee have put back a lot of funding for Care for Kids so that it would be adequately funded. Republicans have not yet done so. This is going to be an area for compromise in coming weeks. And then even apart from the Care for Kids issue, looking at the questioner's bigger concern, costs for childcare are a big issue, and it's a factor not only for kids being in care, but for parents being able to work. So this is something that we're going to continue to focus on in years to come.
Mm-hmm. So 2 questions around 4th grade proficiency rates that came in. One says, given the low 4th grade proficiency rates, it seems counterintuitive that high school graduation rates are increasing. Is this a case of just passing students on despite learning? How do we change the proficiency trajectory? Are we addressing alternatives to a traditional college path for those students? And then another question related to that is there a correlation between the low 4th grade math scores and incarceration rates?
Great questions, and I'll do my best to answer them adequately, but may need to go back and do a little bit of homework on some of this. So the 4th grade trajectory on proficiency for both math and reading is not great in recent years, or over actually a pretty long period of time. We've made a little bit of progress, but not all that much. So why, if that's the case, are high school graduation rates increasing? There's been more effective focus, I think, on the high school graduation rates, and especially, as I said, in the poorest districts like Bridgeport. So I think, but I can't really be certain, that it's legitimate and that it's not just a matter of passing students on. I think that there has been, as I said, an effective focus at the high school level to legitimately graduate students. But there is still more work to be done at the 4th and 8th grade levels. And I am not really sure exactly what should be done. I know that there was the recent decision in the CJEF versus Rel case where districts all around the state sued, saying that there was more funding needed for truly equitable education, which I definitely believe is true. Unfortunately, the plaintiffs in that case lost, the state won, and so now the ball is in the court of the legislature to try to do more to level the playing field and make it more equitable. But there's not a lot of pressure coming from the courts from that because of that decision at this point. So I'm not sure that that's going to do what we have the result that we want. With regard to alternative pathways for students, that's also an important area to look at. Connecticut doesn't do a lot to focus on vocational technical schools, for example, and there are some students that are not likely to succeed in college, and maybe college is not the best path for them, and there are other ways to earn a living in trades and with apprenticeships. And apprenticeships is one area where the state is beginning to do more, and it really, there could be big improvements in that. For example, Electric Boat in Groton has done a lot of work to encourage apprenticeships because they're going to be hiring many people because of increases in the defense budget in years to come. The same could be done at Sikorsky in Bridgeport or Stratford, as well as for other defense manufacturing in the state. So that's one area to look at for alternatives. And then, sorry, RJ, the second question with regard to the 4th grade reading scores, what was that again?
Is there a correlation between the low 4th grade math scores and incarceration rates?
Yeah. So, breaking that school to prison pipeline is something that's really important to do. And I think that there definitely has been a correlation in past years, but incarceration is one area that the state's been making really terrific progress around. And in preparing for today's webinar, I was looking at a quote from Mike Lawler, who works in the State Office of Policy and Management under the governor and is in charge of issues around correction and incarceration. And he was saying that he really feels that Connecticut is breaking that school to prison pipeline, in part because while there's been a 30% drop in prison populations in recent years, there's been an even greater drop for people under 30 years old. And there have been a lot of changes in juvenile justice laws in Connecticut, including raising the age. So hopefully we're making some progress from the corrections end on reducing incarceration, but we still have a lot of work to do, as we said, on trying to improve those test scores so that kids succeed in school and stay in school.
Great. So we got time for a couple more questions. Thank you all for those that have submitted so far. We're trying to get through them all. If we don't get to them, we'll follow up with you individually afterwards. A couple last ones we have here. One, how will the proposal to combine all community colleges under one umbrella affect this population and the effectiveness of the community college system? It's a big question, but
yeah. So
any thoughts?
that is something that we've looked at. And it's too soon to tell. The merger hasn't yet occurred, and it's possible that it won't occur, but it's pretty likely that it will happen. They are saying, the folks from the community college system, that they're going to make sure that it doesn't reduce services to students, but you do have to worry and wonder about how they're going to be able to provide adequate counseling for students, which is already inadequate, and now there's going to be, further cuts as part of this merger. Then I'll just mention too that Fairfield County Community Foundation sponsors the amazing Family Economic Success program at Housatonic Community College, and I think it's still at Norwalk, and that's been really terrific as a model for how to do things well. Although there are going to be these big cuts at community colleges, I'm not necessarily opposed to the concept of the merger. I think that can have some advantages as far as creating better career pathways. Went to a presentation last year at Housatonic that I think the foundation helped to sponsor that was looking at this issue. So we're going to be paying close attention to this, and other advocates need to do so as well, to make sure that the low-income population, the population of kids of color, are not harmed, or I say kids, but there's also a lot of adults in community colleges, are not harmed by these cuts. But, I'm more worried about the cuts than the merger itself as to the impact on community college education.
Okay, two questions. Hopefully you're able to sum them up quickly. And it's kind of about moving forward. So one is, what specific employment-related strategies can be executed sooner than later to meaningfully increase household incomes in the next 3, 5, or 10 years without having to wait for educational improvements to kick in? Kind of who's doing that work, what needs to happen to bring it to scale? And then the last question I have is, what would you say are the 1 or 2 policy changes that the state can make to improve an individual's chances of closing the opportunity gap?
Sure. Okay. So on the first question with regard to employment-related strategies, there is some good work happening around this. There's a group called Campaign for Work in Connecticut that we participate in, that the Capital Workforce Partners, which is the Workforce Investment Board in Hartford, is leading the charge on, and QUELF, the Connecticut Women's Education and Legal Fund, has been involved with. Their focus is on, as far as short-term strategies and what can happen, looking at apprenticeships, as I mentioned, in part with the defense model at Electric Boat, perhaps being a model for other sectors around the state, and then also involving sort of a collective impact effort that involves different sectors, businesses leading the charge in insurance and financial services or advanced manufacturing or different areas, working together with nonprofits, K-12 schools, higher ed, to work together to make a difference. As far as 1 or 2 policies that can really make a difference for individuals, I think that's one of the areas that there really has to be a focus on bringing more jobs to Connecticut, more good jobs to Connecticut that pay decent wages and offer benefits. We're focused on, for example, trying to look at scheduling for part-time employees, which is a real problem. And a second area is education. We've got to do better by kids in poor schools in poor districts like Bridgeport.
Great. And that's
keeping that one short because I see it's 12:30, so sorry.
No, I appreciate it. And it's definitely something on our headspace and the other foundations across the state too, really having stronger advocacy strategies for everybody. So to wrap up, first, Jim, I want to thank you. Obviously, there's a lot of knowledge and resources that you and your organization provide. So please follow the Connecticut Association for Human Services on Facebook and Twitter. Lots of great data sets to explore further, including the Kids Count data book, the Prosperity Now scorecard, and the Fairfield County Community Wellbeing Index. We reference all of those today. You can find links on your screen. We're also gearing up for the next Community Wellbeing Report to be released in 2019, so stay tuned. Be sure to save the date for our next webinar on July 18th. We'll focus on ways that philanthropy is innovating and scaling up their work around closing the opportunity gap. We're excited to be joined by City Foundation to discuss their Pathways to Progress initiative that seeks to support 500,000 young people in cities around the world through a $100 million investment by 2020. And then lastly, we hope you'll join us on May 31st for Fairfield County's Advocacy Day, held in partnership with Grace Farms Foundation. Registration is now open, so don't miss a chance to boost your advocacy skills and build your networks. Thank you all again for joining today's Community Conversation webinar. Have a great afternoon.